what is a hybrid breast augmentation? So breast augmentations can either be performed using an implant, such as these, or it can be performed using fat, or it can be performed using a combination of implant and fat. So I've discussed before, when an implant is performed, if this is the breast, we can either put the implant under the muscle or above the muscle or under the lining of the muscle. Occasionally, patients often ask, well, what about using fat? Now, the advantages of fat injection to the breast is, as you can imagine, it's not a foreign body like an implant is. It's just purely your own fat. The disadvantages are that it doesn't give the same look that an implant augmentation does. Meaning, when you put an implant in, the breast kind of has that very round, nice shape. The fat transfer will enlarge the breast, but it'll just look bigger rather than, it will not change the shape of the breast. So the advantage of the fat transfer is that it's not a foreign body and it's natural. However, number one, it doesn't give that rounded shape that the implant gives. Number two, let's say you inject a certain amount of fat, a lot of it gets absorbed. So oftentimes you need repeated procedures to get a significant enhancement or enlargement of the breast using fat. And the third thing that I think is very important is, before surgery, we often do an ultrasound. And when you inject fat into the breast, the ultrasound and the mammogram changes, because occasionally you can get little oil cysts. You may get areas of what we call fat necrosis, where parts of the fat dies and creates calcifications on the mammogram. And so it's important, if one has had fat transfer, to let the mammographer or the radiologist know that they've had fat transfer, because the reading then will be different. So it does affect the mammogram and the ultrasound. Now, a good radiologist will know the difference between a calcification that is normal and not normal. But I think it's important to mention it to the radiologist. Now, there's a third type of breast augmentation or breast implant, or breast enlargement, is when you use both implant plus fat. Why would you do that? So we often do that in weight loss patients. So if someone has lost a lot of weight, and this is the breast, and, the skin tends to have sort of either wrinkles in it, or it's just not a very healthy skin. And when it's a little bit droopy, and we want to put the implant above the muscle, so you can imagine if the implant is here, then if the person's very thin, you may be able to see this edge. And what we then do is we actually put fat in this area, especially. So the implant is there, and the implant gives the round shape. And then in addition to that, we add fat to sort of camouflage the implant. And that way it tends to look a little bit more natural. And in those situations, because by adding the fat, we can then maybe use a smaller implant. So there's lots of reasons why one would do a hybrid, what's called a hybrid breast augmentation. So when we do fat transfer, either alone or with an implant, we have to remove fat from somewhere. So most patients have areas of stubborn fat, either the outer thighs or the tummy or the love handles. So there is that added advantage to get the fat, purify it, and then add it to the breast. So in summary, breast augmentations can either be purely with an implant, purely with fat, or what's called a hybrid, which is when we use both.